Well, hi everyone. Again, I'm the director for our New Zealand registered not-for-profit educational charitable trust called Common Knowledge Trust, and we hold all of the birthing better skills that hundreds of fathers and mothers and I developed in the early 1970s. And I spent years and years and years trying to pass on the concept that fathers and mothers developed along with the skills they developed. The concept was simple and it fit well into the childbirth conversation, which was when pregnant, it's just normal and natural to self learn some birth and birth coaching skills, then use those skills as you work through the activity of birthing your baby. No matter where your birth occurs, no matter who's present, no matter your circumstances or beliefs, your choices, lack of choices, or change of choices, or what happens to or around you. That concept, back in the early 1970s, was rejected by natural birth advocates and at that point home birth midwives. And by the 1980s, it was more firmly rejected. And it was rejected because there was a belief that that pregnancy and childbirth were normal life events that rarely required medical care, and that women didn't need to learn to birth. Cows and cats aren't taught to birth. Women don't need to learn to birth. Fathers shouldn't coach women. They should just support women's choices. So from the early 70s and the 80s and the 90s, I experienced globally an absolute rejection of this concept that so many mothers and fathers wanted other mothers and fathers to go by, which is it's normal and natural to learn some skills in pregnancy and use those skills when you work through the activity of birthing your baby, because it's an activity and humans thrive on being skilled. And all of the birthing better skills were based on our shared human body. We all blink, we all cough, we can all tighten up our rectum. And the reality is that there's a big object that has to come through our container. Now, definitely the cesarean rate was very low when these skills were developed, around 4.5%, and it's much higher now. But it's your baby's birth. You got pregnant to have a baby. And you can enjoy preparing your body because your body doesn't know you're having a cesarean, your mind does. And you can use the skills on the way to the hospital while being prepped and during the surgery to work through your baby's birth journey. You can do that. Any woman can do that, whether they're laboring or not. And so that concept holds up well for all births and includes the vast everybody. Anybody who's pregnant, 100% of pregnant women will give birth. And when I immigrated to New Zealand in the 90s, it turned out that there was a midwifery model of care, and I described that in the description on this video. I left New Zealand for a few years and I came back. I was asked to come back to try to promote this concept within the partnership model. I had tried to do that in the 90s, and the midwifery profession in New Zealand was not interested in advocating that their families become skilled. It was very much partnership based on choices. And so when you have a partnership that has an inequality, then it becomes problematic in the long run. And why does it become problematic? In New Zealand, the reason is that we have a wonderful midwifery model of care. We have a philosophy that supports that pregnancy and childbirth are normal life events that rarely require medical care, which is fine. And then you have to ask the question, why do midwives feel they need to go to school for 4 years? If pregnancy and childbirth are so normal, and the implication in that word, isn't it, that it's easy, with a good outcome, manageable, and really a nothing burger. So why are midwives going to school for 4 years? Just in case. They need to do assessments, monitoring, and some procedures to safeguard the health and well-being of the mother. They see themselves as professionals as having to need 4 years of training. And yet, philosophically, they believe cows and cats aren't taught to birth, and women don't need to be taught to birth, and that women are just instinctive and should be left alone to discover birth, which is a Michelle O'Donnell belief, and a Carolyn Flint belief that midwives should sit in a corner and knit, and that fathers should just be there supporting a woman's choices. So how's that working for us? Because New Zealand is the example of what happens when you have a maternity system that is a midwifery-led system. As I say in the description, it's much loved, and it's falling apart. And it's falling apart for the reasons I give in the description. So when I left New Zealand for a few years and came back in 2013, it was to make a second effort as the director of the trust to encourage New Zealand midwives to give a simple script to all of their clients. And that script goes like this. So if you're a birth worker, you can give this. Right? If you're a pregnant mother or father, you can say this just from a different voice. So I'm going to say it first as a birth worker. Hi, you're my client. How are you? We have a relationship. I want to respect your choices, and we're going to put your choices or your birth plan in your notes so other people can see that. It's also an activity you're going to do with your baby. Here's a handout of different skills-based methods. So it's normal and natural to learn some skills and use them. Pick one or more, and at 24 weeks, we'll start adding those skills to your notes so that anyone can see them. And then during your birth, if your choices unfold the way you want, that's going to be great. If they don't, you're going to be involved in decision making. And if you look like you're coping and managing and feeling in control, we're going to praise you for using your skills together. And if you're looking overwhelmed and stressed, we can refer to your notes and see that you've learned some skills and just remind you to use them because you got pregnant to have a baby. This is your baby's birth. Use your skills to work through the activity of birthing your baby. We sent that out in 2018 to all of the midwives in New Zealand and invited them to participate for 2 years in learning how to give that a message effectively and to change the societal conversation around childbirth because it's a country where it can happen very, very, very quickly. And not one midwife responded to that flyer or our request. And they were very clear that ideologically they believe that more women should have natural births and that what is stopping women from having natural births is interventions. And so in 2013 and 14, when I taught classes to strengthen the partnership, this are the responses that midwives gave when we created a list of interventions that women need to avoid in order to achieve that natural birth. There are 30 of them. And I'm going to post that up now so you can look at it. And I'm going to talk to you about 6 of them today. So remember, this is the second of the 5-part series about interventions. And I've taken 6 interventions in each of these classes. As the director of Common Knowledge Trust and a person who developed these skills in birthing better and passed on the concept that families developed, we see these as assessments, monitoring, and procedures. Those of us who don't want them do not see birth professionals. We don't go into hospitals. We don't have midwives come to our home. We birth without any form of medical assessments, monitoring, and procedures around our birth. If, however, we want to birth within a hospital or a birth center or have a midwife come to our home, then we are going to have some or many assessments, monitoring, and procedures during our birth because as birth providers, they have an obligation to the best of their ability to safeguard us and our babies. And so when the natural birth movement in the 1980s decided that all assessments, monitoring, and procedures would now become interventions, and interventions would now have the meaning that they are imposed on women and unnecessary, and women since the 1980s have created birth plans to say no to interventions or no to specific interventions, then this is why I decided when COVID happened that I have got to come out and start to speak about how crazy the conversation in childbirth has become, because it has become crazy. And who gets impacted by the craziness? We, women, families, societies. Okay. When I gave birth in 1970, we had a skills-based approach, Lamaze and Bradley, but they were targeting low-risk women. And so those skills didn't work. They weren't very adjustable or adaptable or sustainable. And that's why Birthing Better families developed so many skills that were, because they wanted skills for their baby's birth. Right? They wanted to value their baby's birth. They didn't want to only value births that were natural or that were pain-free or had no medical care. They wanted to value their baby's birth. And that's right. That's what we need to have as a childbirth conversation. The value of every family and every child's birth. And that's why when we develop a skills-based approach to childbirth, and we grow a skilled birthing population where it becomes just normal and natural when you're pregnant to self-learn birth and birth coaching skills, and then use those skills to work through the activity of birthing your baby, then we will begin to embrace everybody as having a personally empowered birth. Doesn't mean they're all without medical assessments and monitoring or interventions. It doesn't mean that they all have good outcomes. It doesn't mean that women cope all the time. It doesn't mean anything. It just means that we are working through our baby's birth journey using skills, and we feel more empowered by doing that. So today we're going to talk about the interventions of IV fluids. Why is a woman given IV? Okay, it's to give her fluids. Okay, so if a woman was drinking good oral rehydration formulas and was well hydrated, she wouldn't need IV fluids. It's also a way to give her medications if she needs them. Sometimes they can put a heparin lock in here without the cord, and then they just put the cord in if necessary. It's a nuisance. But you know what Birthing Better families made a decision about? Get on with it. Use your skills. Get on with it. That's an annoyance. It's a nuisance. You might not want it. What are you going to focus on? How pissed off you are? Or are you going to get on with birthing your baby? We made the decision to get on with birthing our babies and to be pissed off. We didn't care, right? Couldn't do anything about that. We could do something about our behavior, our responses, and the choices we make to be engaged in our baby's birth actively as parents, or we could just be teed off at them and be passive throughout the birth of our baby. This is what we were beginning to see, and it was very sad, very sad. So if you have an IV, that's the way it is, right? Is it an intervention? Doesn't stop you from using good breathing skills. Doesn't stop you from relaxing inside. Doesn't stop you from making space between your sit bones. Doesn't stop you from working with good teamwork with your partner. IV doesn't stop you from doing anything. But if you don't have the skills, you don't know how to use them, you choose not to use them, then that IV has stopped you from engaging actively in birthing your baby. And we think that's sad. Pharmaceuticals is another intervention. Obviously, if a woman is taking medications before pregnancy or in pregnancy, is that what they mean? Because if pregnancy and childbirth are normal life events that rarely require medical care, then we have to ask ourselves, if we have 1,000 women in a room who are all of childbearing age, but none of them are pregnant, how many of those women are taking pharmaceuticals now? Lots. Well over half, probably well over 2/3. What could they be taking pharmaceuticals for? Depends on what their problem is. Asthma? Diabetes? Why are you taking them? Stress? So that the idea that pharmaceuticals stop you from engaging in your baby's birth doesn't make sense. Even the pharmaceuticals in birth that they may give you. And what's the most likely pharmaceutical they're going to give you in birth? Pain relief. And why do women need medical pain relief? Because they lack skills. We can't control how painful labor is or whether an epidural works effectively. If we have skills, though, we can cope, we can manage, we can work through, we can deal with, we can handle, we can stay on top of and feel in control. Sometimes we need the help of our partner, and thank goodness they have skills to help us. So having pharmaceuticals in birth, vitamin K, stop you from bleeding after your placenta is born. Are these interventions, meaning they're unnecessary and imposed on women? Sometimes. It's true. So what are you going to do about that? Are you going to find yourself directing your attention to being pissed off with them? Or are you going to just get on with using the skills to continue to do the activity of birthing your baby? We hope you do the latter. Because many birthing better families have pharmaceuticals or IVs. We're empowered because we're skilled. And you have to find analogies to this, right? And there are plenty in life. There are many, many situations in our lives where we don't like what's going on to us around us. And if we're skilled, then we cope better. Birth isn't any different, except that it's infrequent. And it's a one-off, and you can't replay it. And so we treat it as though it's somehow a different activity than any other activity. But it's no different than any other activity. Oh, you say it's physiological. Yeah, well, so is being horny or being hungry. We apply both of those things with heaps and heaps of skills if we have any common sense. And if we gave birth as frequently as we did either of those two things, we'd have hundreds of authors providing skills and resources to birth better. But we stopped that conversation in the late 1970s when the natural birth advocates and the home birth midwives didn't feel that the Lamaze, Bradley, and Grantley Dick Reed skills worked to achieve enough natural birth for low-risk women, enough pain-free labors for those using the skills without medical care. And so they said skills don't work. Women know how to birth. Women need to be left alone, as a famous author said. And a famous midwife said, midwives should sit in a corner and knit. Well, why are they even there? And that's what we ask in the description. If childbirth is such a normal and natural, meaning easy peasy, nothing to it, honey, why are midwives getting trained? So, pharmaceuticals. Yep, you may have them. What's our advice to you? Use your skills and keep working through the activity of birthing your baby. It's your baby's birth. You're lucky you're not in war. You're lucky you're not in a famine. You're lucky that a tsunami isn't about to hit your shore, or a wildfire, or a hurricane. You're lucky. So the next intervention is handling or overtouching. That's an interesting one. That's really in the ilk of leave women alone to discover birth. You know why fathers came into births in the 60s and 70s? We wanted them. Why did we want them? We wanted them because we didn't know how to birth our babies. We didn't want to be left alone. We wanted somebody to help us cope and manage and handle and stay on top of and feel in control. And that's what Lamaze and Bradley and Grantley Dick Reed gave us as couples in the 60s and 70s. Imperfect skills, but skills. So, do women really want to not be touched or handled? Yeah, some don't, but some don't at this moment, and some then crave it at that moment. So, really, what we need is the right touch. And that's one of the skills in birthing better, because this was a question that families asked. A man at a birth trying to help will reach out and try to comfort the woman with touch. And if she's concentrating on the contraction, she often will go, flick his hand away, glare at him. He interprets that as never touch me again. But that's not right. It's just at that moment that was a distraction from her focusing. So we had to develop the right touch, the right place, the right time. And we did. Because this is a no-brainer. Women want to be touched in birth. They just want to be touched in the right place, the right time, in the right way. And when you learn it together, then it's really quite magical. So that's considered to be an intervention, something that's imposed on women and unnecessary. Now, what about touch from labor and delivery nurses or midwives or obstetricians? We see a lot of videos on YouTube where a doula or a midwife is cuddling a woman. So why doesn't that come under that being an intervention then? Ask yourself that. So sometimes we don't like how a person touches us, or they don't touch us at a time where we feel we can cope with it. And sometimes that happens. But instead of saying handling and overtouching is an intervention, really we want to develop the right touch, the right time, and the right place. And that's what Birthing Better Families did. What about directing women? This is where fathers in my generation, they were coaches. We expected them. If we were having difficulty coping and handling and managing and working through and dealing with and staying on top of and feeling in control, we wanted them to direct us. We wanted them to breathe with us. We wanted them to tell us to soften and relax. We wanted that. And what's curious is that in the United States, a lot of labor and delivery nurses and even obstetricians picked up on some of the Lamaze skills. But really what the natural birth movement was about was absolutely one part of the Lamaze. Did I like it or not? Just what it was. Drop your chin, take a deep breath, drop your chin to your chest and push. And then everybody starts to say to women, push, push, push. Now this corresponded to an interesting thing that was happening at the same time, because most of you don't know this. And it's my responsibility, having lived through all of this, to remind you where things came from. Because if I'm sitting there saying, as the director of a trust, childbirth conversation is crazy, we need to change it, it's crazy because of what happened. When I gave birth in 1970, we were all lying flat on our back with feet up in stirrups. And the natural birth movement said it's anti-gravity. You're right, it is. However, when you stop listening to this, lie on your back, put your feet up in stirrups, and you'll see how very open your pelvis is. Okay, pay attention to that, because what I'm going to say next is going to help you understand something. Okay, notice how open your pelvis is. Lying on your back, feet up in stirrups. Okay, you're open down there, but you're not in a gravity position. So natural birth movement wanted you in a gravity position. They weren't paying attention to the pelvis. So what position was first advocated? It was a semi-recumbent position. So I'm sitting up in a chair, you are, but a semi-recumbent position is sitting back on your sacrum with your feet up like this, which puts more pressure on your sacrum. So do that. Compare that to how open you felt lying on your back with feet up in stirrups. You weren't in a gravity position, but your pelvis was open, and this big object can come through that more easily than if you're closing the sacrum. And so when women went into this gravity semi-recumbent position, they had more difficulty getting their babies out in second stage because they blocked the sacrum, which is the bone the baby needs to move in order for it to come through the outlet of the pelvis and turn the corner of the pubic bone, come under the pubic bone, and start to open up the sacrum. So we women told each other, sit on your sacrum, because we women didn't have an effing clue that doing that made a dick of a difference. And that's what Birthing Better Families realized. It did make a big difference. And so everybody was directing women to push, push, push harder, 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 without recognizing the reason the women had to push harder, harder, harder was that they were blocking off the ability of the baby to come down through and out. Directing women isn't an intervention. It's an effort to try to help women. So when we say to each other, I'm going to just be left alone, and your care providers leave you alone, and you find yourself struggling, overwhelmed, or suffering, or stressed by what you're feeling, you want someone to help you. They're sitting in the room with you. And you believe correctly that people who have been in a lot of births have seen more than you have. And that their reason for helping you is because they're trying to help you cope and manage and birth your baby. So when we tell fathers, just let women alone, she knows what she's doing, and he's standing there, and the woman is moaning and groaning, thinking to herself, why doesn't he help me? It's because there is no societal expectation that when you're pregnant, it's normal and natural to learn some birth skills and then use them together when you birth your baby. And when we talk about directing, often women will turn to their doula or their midwife, who they believe knows more than they do. And those women freely give suggestions. So they can give suggestions, they can direct. But really what they're saying is that the people who work in the medical field shouldn't. And that's why it's so crazy today. Okay. Cesareans is an intervention. When I gave birth in 1970, there's a 4.5% cesarean rate. 95% of us labored. And we labored because risks were considered to be normal, natural, and physiological, and the maternity system was not as sophisticated as it is now. We didn't have ultrasounds. We didn't have constant fetal monitoring. We didn't have ROGAM for Rh negative. We didn't have a lot of stuff that you have today. And we couldn't, as women back then, say to the medical profession, I don't want my breech baby to be put at risk, do something. I don't want my twins to be put at risk, do something. And that's just two tiny examples of other risks that we had. And we labored. Whether we labored for hours or days, whether we coped or we suffered, whether birth was manageable or not manageable, whether we had a good outcome or a tragedy. It was considered normal, natural, and physiological that risks existed. We didn't have any birth control except for diaphragms and withdrawal and rubbers back then. So if we had a tragedy, it's just soon we'd have another baby. So where did so many cesareans come from? The natural birth movement would have you say it's coming from doctors running around with knives in their hands waiting to cut us open. But I lived through this, so I can honestly tell you that it came from us as modern consumers, right? When I gave birth in 1970, we had a classical cesarean. We were knocked out. It was major abdominal surgery. They cut our uterus like this. Some of us wanted to have VBACs. They were done to save our lives. Everything else, we just labored, and risks were involved in that. But in the 1970s, we started to wear bikinis. And women didn't want to be left with a scar. So the medical profession came up with what you now know as a bikini cut. They didn't name it that. We demanded it. We did not want to be left with a scar in our belly. We wanted our husbands to come into a cesarean, so we didn't want to be knocked out. So they came up with a spinal and then an epidural. We didn't want our twins or our breaches or other issues to end up with a possible tragedy. So let's get really clear about risks and problems and tragedies. Lots of risks. They're not infinite, but just lots of risks. So if you've, I don't know, any issue that you might have, okay, that's a risk, right? You may have more than one or two. Some risks become problems, okay? Fewer problems become tragedies. It's very much a pyramid. Lots of risks, potential problems. Fewer problems, most of them just resolve fine. Infinitely fewer tragedies. But we don't know. So the medical profession does these assessments, monitoring procedures, which the natural birth movement calls interventions and implies that they are unnecessary and imposed on you because we all know that pregnancy and childbirth are normal life events that really require medical care. So those 1,000 women who are of childbearing age who have medical issues or abuse issues or any issue that they have, once they get pregnant, some issues just go away, some get worse, and there are new ones. And then there's the baby. Baby may have issues. And at birth, it's the same thing. Some issues just never become problems. There are new issues that can become problems, and there are some that can become tragedies. And so the medical profession, modern medicine, working with modern women who see themselves as upwardly mobile, crave modern medicine. And if you think we don't, then stop taking your meds. Don't give your kids antibiotics or immunizations or cough medicines. Don't put anything to stop the itching of mosquito bites on. Just do it all au natural, because life is a normal life event. Right? But we know that we can have issues, and modern people have access to modern care, and they are risk averse. So we as consumers drove the increase in cesareans because we would rather not risk our baby. So are cesareans an intervention? Yeah. Are they sometimes unnecessary? Definitely. Why? Because there is no societal message that it's normal and natural when you're pregnant to self-learn birth and birth coaching skills and use them. It's all about birth plans and birth choices and saying no to medical care, but it has nothing to do anymore with you doing the activity of birthing your baby or having a partner who knows how to help you cope and manage. Nothing like that anymore. So what's the first thing that women are doing? What are they using? They're using epidurals as pain relief. They work, don't work. Why do we use epidurals? Because of internal tension. We can reduce that with skills. So we have put ourselves in a pickle and in a bind. And if I, as a pregnant woman, have a non-laboring cesarean, my body's preparing for birth. It's my mind that knows I'm not going to labor. It's great to learn skills and feel closer to my baby and my partner when I'm pregnant. I get pregnant so infrequently. I want to reap every benefit from it. So learning skills just thrills me. It engages us. And then we use our skills on the way to the hospital together. We may be separated. So we both know to use our skills separated. Then we come together for the birth. And we use our skills together to birth our baby. We're more likely to lower the cesarean rate by growing a skilled birthing population than by having a choice one. We grew more cesareans under a choice-based childbirth trend. So let's try at least adding skills to the mix for everybody. And if you're a pregnant woman going to a birth professional, tell them you're learning skills. Have them mark in your notes from 24 weeks on what skills you're learning. Tell them if we look like we're coping and managing well, praise us for God's sake. And if we look like we're overwhelmed or stressed, refresh our memory that we're working through our baby's activity to be born, and we should use our skills as our effort as parents to do that. So the last one is episiotomies. When I gave birth in 1970, we all had episiotomies. Why does the medical profession do episiotomies? Did you ever think about it? They're seeing us down there. We're lying our back with our feet up in stirrups, or we're in a semi-recumbent position since the 80s with our knees bent. People can see our crotch. People who have been at births a long time can also tell you whether that baby's moving down smoothly and consistently and efficiently or not. So why did doctors use forceps or do episiotomies? It's no brainer, really. We're tight down there. Men like that. How big's a penis compared to a head? That big? Where am I going? That big? That big? Head? That big? That's coming out of you. Don't you think it makes more common sense to know how to prepare the soft tissue down there for 5 minutes a day for 8 weeks? Is that too much time? In order to soften, make mobile, increase the birth hormones down into that tissue, allow that baby to open up its birth canal rather than stretch you and perhaps damage you for life? Because that size of an object coming through us can cause us to tear, or they're going to give us a cut. We can heal up with scar tissue. We can have pain on sex the rest of our lives. Although if you do the internal work gently over that scar tissue, it takes about 2 weeks for you to soften that scar tissue. Or, like many women my age, whenever you cough, or you run, or you sing, or you laugh, you pee. Because that big object stretched unprepared tissue and damaged us. Or sore tailbones. People have long tailbones. They knew about it. So doctors did episiotomies because they were dealing with tight crotches. You have the ability to change that just by doing 5 minutes a day for 8 weeks. Either your partner or you do it yourself. That's all in Birthing Better. Do we care that you use the Birthing Better resource? No, actually we don't, because there are skills-based methods out there, and you should have a choice of which one. You shouldn't have a choice of not becoming skilled. There should be an extremely high societal expectation, again, that all expectant families self-learn birth and birth coaching skills and use them throughout their baby's birth. No matter where the birth occurs, no matter who's present, no matter the woman's circumstances or beliefs, no matter your choices or lack of choices or change of choices or what happens to around you. We want to grow skilled families because it benefits every single person. Benefits us as women, we cope better. Benefits our baby because we're not having to deal with a mother who's so blown out from her birth that she has trouble taking care of us. Benefits fathers who know they've helped. Benefits birth professionals who enjoy working with skilled families rather than people who are always feeling out of control. And it benefits our families in general because when we're skilled, even though we have imperfect births, even if those births include challenges and even tragedies, we are more likely to resolve these traumas because we used our skills than if we just got swept along like a leaf in an ocean. So this is the second part of the series, within the series, on interventions. We're going to do 3 more. We have to stop calling them interventions. We have to go back to using the words assessment, monitoring, and procedures. It's great if you want to make a birth plan and say what you want and don't want. But just remember this thing. And if you're a man listening to this, listen to this. I've been involved in birth for 50 years. I have listened to tens and thousands of birth stories from around the world and thousands of women who have made birth plans. Less than a handful of women's birth unfolds the way they plan it. Babies don't come to plan. You never know what your birth's going to be like. But there's something more important. Women make birth plans based on ideology. But when they get into the experience and they change their mind, you're now in a dilemma. You're with a partner who says she doesn't want to have an epidural, but she can't cope with the pain. And you say to her, but you said in your birth plan you didn't want an epidural. And the woman says, you're not doing this. You don't know how much pain I'm in. So you support her change of choice at that moment, believing it's informed consent. 6 months later, 18 months later, she's pissed off at you because she felt in hindsight she could have gotten through it if she had had more support from you. But if you don't have skills, you can't support her. And if she doesn't have skills, she can't help herself. So when we're talking about birth plans, of the tens and thousands of birth stories I've listened to in countries where women make birth plans, more women will tell me they just went out the window. So women are spending hours and hours and hours, week after week after week, making choices, making birth plans for something that doesn't unfold the way they want. And they're spending no time learning skills for an activity they have to do. This isn't okay. This is why we want to change the childbirth message. This is why you now know what the concept is. And when you're pregnant, learn some birth and birth coaching skills and use those skills to work through your baby's birth journey, in and around all the medical assessment, monitoring procedures you may have or not have. Because this is your baby's birth. It's one-off. It's infrequent. You can't replay it tomorrow. The memories last a lifetime. What you want to remember is your effort and the work you put into it from the skills that you've learned. So go for it. Love you. Talk to you later.